cheek filler, Restylane, or Juvederm to help eye bags. I went to a surgeon today, and he told me that I don't need Restylane tear trough filler, and that my eye bags can be made better by adding volume to my cheeks. When I looked at reviews, Restylane works great. Will cheek fillers really work on my eye bags?
Thank you for your question. You've submitted several very good photos, and you are stating in your question that you saw a surgeon who you went to about possibly using Restylane for your under eye bags, but the surgeon actually recommended that you get filler in your cheeks to treat the under eye bags, and you're asking whether or not that would be beneficial for you. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Under-eye bags have been probably the most popular procedure in our practice, or issue in our practice, to resolve. And it is a time where the question about the best option continues to be open, because there are more options available than there were 10 to 20 years ago. So first, I'm going to give you some guidance in understanding what you're dealing with and why you have under eye bags. The under eye bags are generally a genetic trait that often runs in families, can occur as young as in the teen years. I have patients who come to me who said, whether they're in their 30s or older, that they've always had bags under their eyes, and they got progressively worse. What these under eye bags represent are fat pockets, and these fat pockets have pushed forward and created these bulges. Now, looking at your photo, you may be asking yourself, you have a thin face, why do you have fat around your eyes? And it's just unfortunately a reality of genetics. It just so happens that some people will just get this fat prolapse, and it'll create this bulge under the eyes that creates the perception of looking tired. Now, years ago, when the hyaluronic acid fillers like Restylane were first introduced, the concept of helping people soften the appearance of under eye bags started to gain momentum, particularly amongst non-surgeons. And the challenge, unfortunately, is how much filler can you really apply before it makes things worse? And that's one element of the type of question you're asking. So you mentioned a filler like Restylane. Well, frankly, from my experience and from what I see in your photo, I don't think Restylane will be effective. And the reason is that if Restylane is being used to fill the tear trough, well, how much volume can you place in the tear trough before it actually augments or adds to the volume of the under eye bags? I see patients from around the world who come to me after they've got an injectable filler, and it is my job to try to get rid of that injectable filler so that we can see their real anatomy. And that brings me to the next issue. With due respect to your doctor, my perception is, in order to actually hide those bags, it would take a fair amount of cheek volume augmentation in order to blend with the under eye bags. Now, respectfully again, this may be a look that you would be happy with. You know, the nice thing about injectable fillers, of course, is they are temporary and they are reversible when you're using a hyaluronic acid-based filler. However, when I look at your face, and this is my perspective and how I speak to patients like yourself, I look at a person with a thin face and I ask the patient and I ask myself, does volume in that area that is fairly significant look natural? Or do they look like they're swollen? And I think in your situation, it's more likely that you would look swollen. Understanding that, I review photos with patients in a way to help them understand that although their focus may be on the under eye bags, very often they also have a concurrent relative amount of hollowness in the adjacent eyelid to cheek junction. So I explained that when I address under eye bags in a situation like yours, I would typically do something called a transconjunctival blepharoplasty. What this means is I would actually reduce and sculpt the fat from the inside of the eyelid so that the fat is no longer herniated or pushing forward. Now once that's done, you may actually expose some anatomy which would benefit from some volume enhancement. It is a very subjective issue. A lot of times people have the bags removed and they are happy. They're happy they no longer have bags and they're done. Other times the reduction of the under eye bags reveals a little bit of the rim of the bone, especially if a person is very, very thin. And then a strategy has to be applied to soften that appearance or to improve that appearance. But I would argue that you would actually use much less injectable filler to soften that area than you would to augment it and keep the bags. So to me, and I always explain that it's kind of a paradox, you're reducing volume in one place while supplementing volume in another place. So I think you should probably consider meeting with other doctors about the option of surgical intervention of the under eye bags. Now this is a recommendation I'm suggesting based on with the absence of a physical exam, but by looking at your photos, I think I can be fairly confident that my recommendation would be to reduce the fat pockets and then consider fillers and other options to enhance this area if appropriate. There's always a change in the architecture and there's a change in the perspective once a more definitive procedure is done. So learn more about your options and see what is comfortable for you and then move forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.